So we may wonder, what can we do to avoid this? And we're going to dive into some of that today. Of course, there may be some age-related matters, such as people who have muscle mass loss or sarcopenia. We've got people who may have dyskinesias and gait disorders, people who may have cognitive impairment, vision and hearing changes. We've also got foot problems that may cause pain, like, for instance, diabetic neuropathies, or even simply having numbnesses in your lower extremities can lead to a falls risk. Additionally, there's of course polypharmacy, a growing issue we have in this country. We unfortunately spend about $500 billion every year in managing, honestly, and the mismanagement of medications and the harm that comes from that mismanagement of medications. And of course, there's addressing the safety hazards we may have in care facilities and homes across the country. So, kind of intrinsic to what we've seen here, how do we strengthen or reduce falls risk, right? We would want to look at strengthening muscles. We want to look at how can we improve vision and eyesight, and how are we making sure the environment is cleared, and that could be done from a policy standpoint. And additionally, of course, in addressing the common side effects associated with falls, dizziness or confusion, we may want to see if there's any medications that are the source of these issues, right? So, are we seeing polypharmacy or hyperpolypharmacy? Generally, what's defined as polypharmacy is the use of five or more medications. Hyperpolypharmacy is a newer term, not seen as much, but for people who are maybe taking more than 10 prescriptions. People, at least in a study in Europe, who were 85 and up and suffered from polypharmacy, the addition of just one medication to that med list led to a 3% association in mortality. Okay. So there are multiple factors here, but we can still modify some of these risks by looking at deprescribing as an opportunity to reduce harm.